good afternoon, good evening, and allow me open my camera. I hope you can see me well. Now, this is Mwine Bob Wayne from Uganda, and I want to welcome everyone to the Africa Social and Behavior Change Summit. It is really an absolute honor to open this youth event. And as I want to know whether we are as excited as I am, and I will ask us to share emojis of us feelings right now, and I believe we have some quite a number of youth. Just share an emoji of how you feel right now, of how excited you are. Let's get some bit of excitement emojis. I want to see as many as possible from the young people because this is our event. Yes, I can see the messages coming through. The emojis are less. Let me see them coming through. Yes. So I'm very glad that we are here. Finally, it's been a ride for the last what, 2, 3, 4 months, but I'm glad this is our first of a kind. And I want to also take this opportunity to say that I will be sharing the stage with my colleague, Miss Yasmin Zongo, and she will, of course, be speaking shortly. First and foremost, a warm welcome to our country chapter leads and chapters. I don't know whether we have country chapter leads in the house or in the rooms. Please, I want to also see their presence. Can you please share your flags with us? Just share where you're coming from. I know some of us have shared a few in the chat section. Let me see them coming through. I want to see the different countries that we have. I want to see Africa. I think I have a background that speaks to some of the nations. Let me see if we are in the house. Oh, I think we are struggling with that. But again, I want to say you are most welcome. And for the young people, this is our day. This is our day, first and foremost. Again, I want to say our potential and power as the youth is big in Africa. And of course, that speaks from the background of the numbers that we have. We have a projection of around 400 million young Africans. That's quite a big number, and I'm hoping at least a quarter of that number is going to feel our impact today. So I'm going to encourage us again to use our social media platforms as we're guided. Go to Africa Social and Behavior Change, the African Society for Social and Behavior Change. Go and interact. Go and share how you feel. Go and spread your excitement and sentiments and your what you're looking out for these 3 days. So I'm here to remind us of the power of the energy, of the creativity that we intend to harness and we intend to evoke during this period of time. And I want to say, of the 400 million young people and over 1,200 plus universities across Africa, and of course that is now for those who are even at that level. We have very many who have dropped off, but again have been innovators and have started very many startups. We've seen tech innovations coming up from different Africans, and I want to say, with that front, with that energy, with that power, I think we can do a little bit more. Social and behavior change, which is at the center of our summit today. That's why we are here. It's the force that is going to give us that leapfrog to certain situations, and we are yet to know, because today we are going to be having different panelists and different people speaking to these innovations, inspiring us, telling us what is it that SBC is, what is it that is in the job landscape, what does it make sense of the whole practice and field. They're going to help us understand. We are going to know why we are pivotal in this. And I want us to imagine, of course we have imagined before, but I want us to imagine a vibrant, dynamic Africa, where youth, of course, are the forefront, of innovation and change. I want to say you as a young person, together, we are the heartbeat of our continent. I want you to look at the past, the past campaigns that have been run on social media, led by young people. Look at our neighbors here in Kenya that have stood. This is now governance, but this is also part of SPC somehow. So look at how the youth are charging up, leading innovations, leading movements across Africa. And this is why we are here today. We are here to harness that energy. We are here to inspire. We are here to connect, and we are here to network. We are here. Do you have that idea, that groundbreaking idea that you've had for quite some time, even if it was born last night? You do not know, someone just next to you here could be um, um, the next partner you have on board. So as a young person, I want to say your ideas, actions, and voices during and today they really matter. And I will say, let's seize this opportunity, let's work, let's collaborate, let's build these lasting connections. I'm excited, and I want to say it's an opportunity to have you here with us. And please, this is your day, this is your time, this is your moment. Speak to anyone here. We have experts from different fields. We have CEOs, we have founding members, we have companies. Reach out, say hi, and speak about yourself. Thank you so much, Marcy. And I'll say let's make this summit a memorable and transformative experience. We are using the hashtag Africa SBC Summit 24 and hashtag the next big thing. And I hope, and I know, yes, and I'm convinced after seeing this that we are the next big thing. Thank you so much. Over to you, my colleague, Yasmin Zongo. Please blow us away.
Merci beaucoup, Bob. Bonjour tout le monde. Bienvenue à ce grand rendez-vous du sommet africain du changement social et comportemental. Et ce rendez-vous qui se veut vraiment une session d'échange, une session de partage, d'expérience, de renforcement de capacités en matière de changement social et de comportement. Vous êtes nombreux à continuer à nous rejoindre à ce sommet virtuel sur la SBC, dont les discussions seront principalement axées sur comment cultiver la résilience et la pertinence en exploitant les idées et les innovations communautaires de chacun de vous ici présents, des experts du secteur, mais en exploitant également les perspectives des décideurs, et tout cela en vue de renforcer l'impact de la SBC en Afrique. Le monde s'y est en pleine évolution avec ses bouleversements en matière de contexte, en matière d'avènement technologique, où l'innovation est devenue aujourd'hui une valeur vraiment importante dans les interventions et les projets de développement afin d'assurer une résilience effective. Il convient donc de discuter, d'échanger, d'apprendre les uns des autres, car il est vraiment nécessaire d'opérer une mise à jour de nos stratégies, de nos approches, au regard de ces bouleversements et des croyances actuelles de nos communautés. Cette session constitue alors une aubaine pour revisiter ce que c'est que le changement social et de comportement, ce que l'on entend par changement social et de comportement en termes de curricula dans nos institutions d'apprentissage. Pour tous ceux-là qui sont déjà dans la pratique ou qui aspirent à s'y engager, l'opportunité nous est donnée aujourd'hui de discuter ensemble des stratégies innovantes de SBC qui combinent efficacement connaissances locales et technologies de pointe, mais de voir aussi comment certaines de ces initiatives-là peuvent être du moins intégrées dans des cadres politiques plus larges. Alors, chers amis, bienvenue encore à cette session, à ce sommet extraordinaire. Puissions-nous donc échanger, apprendre des recherches et expériences, partager ce qui marche, ce qui ne marche pas ou ne marche plus en vue d'une SBC pouvant réellement impacter nos communautés africaines. Merci encore, Bob, et merci, Farah. Je vous remercie.
Bob and Yasmin, thank you very much for this warm welcome. Thank you for making everyone excited about the day and about the summit. Thank you for the amazing interaction you got in the chat. Let's start off the day with the first session by Belendor from Kenya, who will talk to us about SBC and how it's professionalized. Belendor, the mic is with you.
Thank you, Farah, for that kind introduction. Real shit was my first encounter with the intricate world of social and behavior change. Crafted by social impact professionals from 17 Triggers, Real Shit is an SBC campaign thoughtfully developed to provoke emotions, shame, and disgust in order to achieve behavioral change. While Cambodia had a glaring problem of human waste and poor latrine uptake, communication materials to discourage this behavior often portrayed human waste playfully. In other instances, communicators used animated graphics to encourage the uptake of latrine use. These initial interventions failed to address the challenge because they did not capture the accurate situation as it was in Cambodian communities. The Real Shit campaign model was designed with graphic images of real human waste to de-romanticize poop. This real representation of a societal disaster enabled Cambodians to take up improved latrines, thus averting the poop problem. The success of this campaign, rooted in the principles of behavior science, piqued my interest in SBC. Our colleagues at USID define SBC as an approach that uses systemic insights into why people behave the way they do and how behaviors change to effect positive outcomes for and by specific groups of people. Johns Hopkins University supports the idea that communication is key to SBC. They affirm that SBC can help people adopt healthy behaviors, overcome social and structural barriers, and improve their lives and those of their families and communities. At the heart of UNICEF's organizational strategy, SBC is about understanding the needs of individuals and communities to develop context-specific, people-centered solutions. At JSI, our approach to people-centered change is underpinned by behavior integration. We combine social, ecological, and behavioral sciences with innovations from marketing, design, tech, and other sectors to help people live healthier lives. We work alongside communities, governments, and those often excluded from conversations to ensure change efforts are people-centered. We do this by working with them to gather insights and co-create behavior-integrated strategies that spur people to action and ensure change that lasts. Even with our diverse perspectives and definitions of SBC, we can see that the harmonizing denominator is our collective commitment to positively change lives while ensuring that people's pain points, realities, and needs are put at the center of our initiatives. It has taken years and years of us inspiring positive behavior, documenting case studies, and the end-to-end positive results achieved across Africa, and our continuous commitment as practitioners in this field to have a harmonized language. However, what we now know as SBC has undergone significant evolution over the years. The foundation focused on providing individuals and communities with information to promote healthy behaviors, also known as health education. The growth in this space bore information, education, and communication materials, marking the start of a more structured public health communication. Over time, Growing from just health to development, professionals refer to this approach as communication for development, understood widely as an evidence-based process utilizing multi-channel change. Progressively, this will change communication based approaches to analyze challenges, define barriers, and identify motivators of change in order to design a comprehensive set of tailored interventions that promote the desired behaviors. These earlier adaptations have shaped the shared commitment we have today away from SBC to the entire field of SBC, making people-centered change happen in our diverse capacities. Sadly, the evolution in approach is not reflected in the professionalization of this field. We continue to struggle with systemic challenges such as the misalignment of theory and practice. Degree programs and courses lack the sweet spot to help young people like myself settle into SBC roles. For instance, public health practitioners have not been consistent with integrating behavior change into their technical expertise. This is despite them having training in SBC as part of their academic programs. Indeed, looking from the fence, it would be misconstrued that SBC is a patchwork of different focus areas that have somehow been stitched together to achieve a common goal. It is accurate that practitioners in SBC are from varied courses, ranging from sociology, anthropology, behavior economics, public health, communications, and many more. So why do we have this gap? Why do we have professionals studying modules and subsets of SBC instead of a dedicated graduate program that comprehensively covers the theories and principles of SBC? I muse about this rather loudly while also recognizing efforts from partners like Breakthrough Action through their SBC Learning Central and the partnership between the Center for Behavior Change and Communication and the United States International University to offer a 5-week training program here in Kenya. South Africa's UNISA offers a postgraduate diploma and bachelor's degree in social and behavior change in HIV/AIDS. These are moving the needle towards the advancement of knowledge. We must, however, ask ourselves whether the current CRAMB-like knowledge advancement structure is sufficient to equip the aspiring generation of SBC professionals. Do we feel we are doing enough to pass the knowledge forward? When we consider the incredible gains from TV programs like MTV Sugar, which contextualized the dilemmas and social complexities of negotiating safer sexual and lifestyle decisions among youth to curb the spread of HIV in sub-Saharan Africa, aren't we inspired to ensure that 10 years from now we continue to have life-changing initiatives co-developed with qualified professionals? As we engage in diverse conversations in this space for the next 2 days, I challenge all of us here today, the lecturers in the room, educators, practitioners, curriculum developers, researchers, funders, and all of others in this ecosystem to step onto the plate and take a central role in co-developing SBC courses with young people in mind and advocate for the adoption of these courses into academic curriculums in all universities across Africa as graduate programs. This will enable more young people to have an intentional path into this career. SBC is not just a career choice. It is a fulfillment of our primary duty as a people, positively touching the lives of those in our societies. Thank you. And back to you, Farah.
Thank you very, very much for this amazing talk. It's a very, very eye-opening, beneficial segment. Thank you for your efforts, Belindar. And before we move on to our next session, I'd like to encourage everyone to share their questions and comments in the chat. Let's keep it as interactive as possible. And for our next session, I'd like to start off by saying how happy I am to be facilitating it. So you're stuck with me for a while. This session brings us insights from different levels of experiences and backgrounds, and hopefully bridges the gap between generations experienced in SBC. Our first panelist is Emmanuel from Ghana. Just a small background about Emmanuel. Emmanuel is a communication specialist with over 15 years experience in marketing communication, social and behavior change communications, research, data analysis, community engagement, and channel planning. He's worked on several projects, including Stop AIDS, Love Life, JHU, National Hand Wash with Soap, and many more projects. Next, we have Jessica from Zambia. Jessica is an SBCC specialist with 8 years of experience designing and implementing communication programs to promote positive health and social behaviors. She has a master's degree in communication for development and a master's in development studies and a skilled in formative research, strategy development, and impact evaluation. We also have our third panelist is Olusina from Nigeria. Please excuse me if I pronounce any of the names wrong. Olusina holds a master's in education for primary health care and from the University of Manchester. He has extensive experience in health communication and education, having trained as a pioneer information education communication consultant, IEC, for the USAID Nigeria, supported the Federal Ministry of Health Nigeria Family Health Services project. Throughout his career, he has participated in numerous international training programs. He's an alumnus of the Johns Hopkins University Advances in Family Health Communications, a communication workshop. And last but not least, we will have with us today Dr. Priscilla from Zimbabwe. Dr. Priscilla, I would love it if you could introduce yourself since I had a delay in receiving your bio. But I'm sure everyone would love to know more about you. And once again, before we start the panel, I'd love to encourage everyone to share their questions in the chat for the Q&A session. And let's pass on the mic to our senior practitioner, Emmanuel from Ghana, and start off our session.
Okay, thank you very much. And good morning, good afternoon, good evening from wherever you are. I'm Emmanuel, and I'm here presenting from the Ghana Chapter Secretariat. I'm in the Infinity 970 offices, so I'm presenting here. And as it was said, this is supposed to be an experience sharing session. So what I'm going to share is more of experiences that have been gathered over the years from myself and then from some of the practitioners that I have met in my line of duty. So that is what I'll be doing. If you look at the next slide, I have three main broad areas I want to cover. I'm looking at the beginning of the SBCC. I'm looking at the presently what is happening now, and I'm going to look at the way forward because there's been a long way. I mean, SBCs in Ghana has come a very long way, And as was said by the previous presenter, we started as IEC, which is the information, communication, and then education. And at that point, most of the channels used for these discussions are mainly posters. And then some of them are mobile phones. So we have recorded messages on mobile phones, we play them through, and then we run through communities and things. If we move to the next slide, I'll talk about the fact that this was limited because in terms of research, we had limited research to this effect. So most of the things we have difficulties in understanding consumer lifestyle, consumer insights derived from close associates. So you know somebody, you ask the person about their community and their lifestyle, and then you base your fashion, your strategies and communication around those stuff. And it's more of a unilateral thing because it's just one-to-one and it's limited in scope. So the question then arose as to who is in charge, because some of the questions that came around that time was, who decides how I must live my life? This is how I've been living for all these years. All of a sudden, why is somebody telling me how I must live? I don't think why. So we have what we call global versus local. Who is telling you to come and tell me how I must live? And those are some of the challenges we have. And around that time, too, most of the things we measure were basically awareness and then recall. So awareness, reach, recall. We don't have a number of things that we always respond to or we always measure. So once awareness is created, reach is gotten, recall, we are fine to go. But when you look at the next slide, then it becomes very important because this is a position where you are informing them, you are educating them, and then you are communicating to them. What is their role in it? What are you telling them? Have they told you they need all these interventions that you are bringing to them? And it becomes a challenge. So what we are saying is, don't only educate them or give them knowledge, but look at how they feel. I mean, they also live in a community setting. They have challenges. Talk to them, find out exactly what they expect or what they need. And then you can, based on that, fashion some theories and things to help them do that. Otherwise, you are telling them what they don't want to hear because this is how they've been living all of the time. They give birth to 5, 10, 6, and they don't mind. How are you telling them to space birth? What are you telling them to? And then we realize that in the taking the social context into consideration, then there's a need to look at opinion leaders. So in this case, who are the opinion leaders? We are looking at the pastors, imams, head of spiritual institutions, churches, and mosques, and all those people. So in the next slide, I'm going to share an example of a campaign we ran, which we call the Stop AIDS and then Love Life. So what happened was AIDS prevalence was very low. People were not, especially the young guys, they don't care about having sex. They don't care about that. They all have sex. So what we said is that, yes, we know you have sex, but have the sex more maturely. I mean, take into consideration some of the things. Use SBCC to reverse the trend in the spread of HIV. So what we did was to find the imams, we find pastors, to build on that, to talk to them. So this is the second stage of it. We've come from a place where we are informing, educating, and communicating them. Now we are finding opinion leaders to talk to them. So at least these are people they can identify with. These are people they live in their community with. So they're telling them, at least give them some hope that they are reaching out and they know what the issues are. And then the problem arises as to, yes, so now we know people have HIV. They've come out to say they have HIV. We are saying pray for them. So then stigmatization setting. So we run the next campaign which talks about reaching out. So if you look on the next slide, what we've said is that there was a campaign called the Reach Out campaign, where we are encouraging people to even talk to them. We are encouraging people to even touch them. We are encouraging people to go to them. And this increased the level of awareness, this increase, and brought down stigmatization because most of these guys are the youth and they are over 48% of the population is youth. So if we are able to capture this group, then we are on a better position to move forward. So this was one of the things we did. So in the beginning, it wasn't like this, but at least we've made progress from IEC to BCC to SBCC to SBC, all gradually improving in our communication, in our approaches and the way we do things. So we move from the posters and the mobile vans, and now we are using opinion leaders in addition to posters, mobile vans, and then we are even using mass media to communicate to them. If you look on the next slide, I'm saying that, so we move forward. Presently, the next slide, please. What we are saying is that make healthcare accessible. For you to convince somebody to do this, you have to make healthcare accessible. If the person is not able to access the healthcare, the person will not be able to reach out. So make it accessible. If it's accessible, then create the awareness that it's accessible, you can go. And we are saying that if we add that one to compliance, then we are heading towards changing behaviors of people. You cannot just make it accessible without creating the awareness. And you cannot make awareness, you cannot create awareness if the healthcare is not accessible. And once they begin to comply with the information, then we are having a headway in changing the behavior of people. So from a unilateral position, now we move into more an integrated position where we have multiple channels, multiple sources talking to the people. So what we said was stop attacking diseases unilaterally. Don't just go to a place, talk about teenage pregnancy and move on, talk about HIV and move on, but have an opportunity to be more structured communication. Overall well-being, very necessary. So from awareness, we move to deepening knowledge. They are aware. We have to deepen the knowledge and make sure that they are able to practice what they are learning. Now, at this point, the measure for success has also changed. We used to move from awareness, reach, and then we are saying recall. Now we have opportunity to now measure impact, and then word of mouth and influence of people over them. So if you look at the next slide, what you said was, there was a campaign that came up, and we call it the Good Life campaign. This started by the Ghana Health Service as a behavior change initiative. So people were in behavior change initiative, but this is supposed to be an umbrella brand that is going to capture all the interventions we have. So it's not just one intervention and it's not unilateral. What we are saying is that gather all and then move forward with it. So we started originally as life choices, where there are options when it comes to family planning, there are options. So if life choice is the main campaign, we have all the family planning methods under that as choices that you can use. And then you look at the next slide, we give you an example. So what we are saying is when you move out, don't just go to one place. But for example, if a pregnant woman enters an antenatal clinic, by the time that person leaves there, maybe you can move 2 slides down. Let's move. I want to explain that as well. Okay, here. So if a pregnant woman, for instance, under the Good Life campaign, we are saying that if a pregnant woman moves to an antenatal, one campaign addresses multiple health topics using the main SBC strategy. So what we are saying is, for example, know something about HIV. So you go for antenatal, you are going to check on your status as a pregnant woman. But before you come out of the place, you should have an idea of HIV. Know something about HIV. How is it treated? How is it managed? What is the care for HIV? How to prevent transmission from mother to child? So you went for antenatal, but you are giving all this information. You must also know something about malaria, nutrition, family planning, emergency contraceptive. So what we are saying is, let there be a campaign that have all interventions under it. So Good Life as a life stage. When you go there, when you enter into a home, for instance, what we are saying is that anybody in that home must hear something about behavior change. So it doesn't matter what you brought, but under the Good Life, make sure you inform them about malaria, the need to sleep in an LLI, and you inform them about condom usage or family planning, and then holistically. And what we are saying, what we did was to find out if there's a way we can bring interventions under the Good Life brand. So on the next slide, what we try to do is to make sure that, for instance, if it's nutrition, it will still run under the Good Life brand. On my left is the generic Good Life logo, which we have refreshed and it's newer than this. There's now a new one that we are using. But on the left is the generic one. On the right are various interventions. So they will still be running under Good Life, but we have specific logos And then if you look at the top on the right, left-hand side on the top, there are some slides and so that will show you which particular intervention is that. So presently, we did some of these things to move the thing forward. So from IEC, we've come to SBCC, SBC, and now we are moving into the future. And this is just a summary of all that we want to share. If you move to the next slide, and then the one after that. Yeah, so we are saying that now in the presently, one of the things that has been involved and challenging is the complexity of lifestyle choices. What we are saying that people are as personalized as the gadgets. Previously, when you do poster, you do your vans and then you move on, you are gone. But now we have different lifestyle, different gadgets, multiple channels through which you can communicate with the people. So communicate will now have to be personalized. So now it's not you coming to tell me again. Talk to me on my own test about what interests me, and then I'll be interested in what interests you. So you cannot come and then tell me what you want me to do, but come and tell me what I want to hear. And then based on that, I will help you. I will listen to you and know what to do. Consumers are digital and channels are now digital. So in the midst of all this, we need to assess the role of digital in making sure and ensuring that communication gets to the right people at the right time. And we say that now in the digital age, consumers are now creators and they are now distributors as well. So moving into the future, which I believe is the next slide, moving to the future, which I believe is the next slide, is the fact that don't only inspire the people, but show them how easy it is to practice their behaviors. So don't just inspire. At the second stage, we have told them that inspire them so they can learn, inspire them so they can do. But now don't just inspire them, but show them practically how it's done. And then they will be ready to learn it. Give them positive examples, support early adopters, and make them advocates. So in addition to the opinion leaders, now we are making early adopters advocates. Add them to that. So these are people they can all identify with, and these are people they can work with. If you move to the next slide, what we said is that the future is now. The future is now. The future is now. What we are saying is, don't wait till we are getting there. We've come a long way, but we are not where we want to be, but we are also not where we used to be. So we are in the middle and we are still working towards going to the end. So we are saying that in the end, just make sure that the people within the community will own whatever intervention you are bringing. They must own it. They must be part of it. They must be leading it. How is it going to be funded? Now we are getting aids and things from external sources. They are funding it, and will communities, will government, central government be ready to fund some of these interventions when any project ends? Who takes ownership? Who move the thing forward? Because for us, sustainability is key, consistency is key. So we have to find innovative ways of using the various channels that we have in order to make impact. And then impact will lead to sustainability. And for us, that is key. Maybe the last slide, if you move to the last slide. So what we said is that don't just tell people to change. Don't go to communities and tell them to change, but let them lead the change. Let the people take initiative. Let the people decide that we want to change, and let them lead the change. And one of the things that has worked in this area for me has been one of the action media stuff that has been happening, where you go into a community, the community decides on everything. They lead whatever intervention, they lead whatever thing they want to do, and then they are able to carry this change forward. So what we are saying is, in a nutshell, please move to the last one. I think that should be my last slide. Okay, so what we are saying that in a nutshell, number one, let the people own the thing. Let the people within the community own the thing. Let's get central government, even private partners, to fund some of these projects, so that even when some projects and interventions end, the communication will not end. We can still continue. And then we also said that look at innovative ways of channel usage. Initially, you do 1,000 spots, you do 40 spots, 60-second spots, and you are good to go because you get your reach. Now, the channels will still be the same, but the usage of the channels may change. If you move into a community, you do community activations and things. How do you amplify beyond the immediate communities that you are doing those interventions? And for us, this is key, and it's very instructive that we need to work with. So we know how to move forward in a small location, do the thing, but use channels differently, so in order to amplify. So channel usage is moving from just 60 seconds, 40 seconds, in addition to that, to amplification. And we are looking at all this, and we believe that this will create some impact, and then it will also create sustainability. Thank you very much. Thank you very much.
Thank you very much, Mr. Manuel. Your talk was actually very inspiring. Thank you for setting a proactive narrative for everyone, and we can move next to next we have Jessica from Zambia. The mic is with you.
Thank you. Is my presentation going to be shared, or I'll have to share it on my own?
I haven't seen your slides. Oh, I have them. They just came in. Sorry.
Okay.
I'm opening them now. My apologies. Do you see your slides?
Yes, I do. Thank you. All right. So I'll skip over this slide since I've already been introduced. We can go on to the next slide. Thank you. So for me, as Emmanuel said in his opening, that these are just sharings from me personally in terms of what I've experienced in my work in SBC. So it's not based on any kind of framework out there, but also just sharing what I've experienced, especially as somebody who's just recently come into SBC work. So for me, one of the things that has been very outstanding in terms of influencing the way I go about my work is that I've realized that cultural influence is one of the most significant factors that is needed for impactful social and behavior change communication interventions. Any other consideration is secondary. And this builds up on the fact that a lot of people are influenced by how they have been raised, their social and cultural norms. And so if we are going to engage them to adopt a specific behavior, then we need to have some level of understanding in terms of where they have come from, where they are at, and why they are doing what they do. So in all considerations, there are other factors that you can consider, but cultural influence should always be at the topmost, so that you do not seem to be a person who does not have any regard for the intended audience that you are implementing SBC activities with. I have also learned that SBC should not aim to replace local traditions with modernization. We have people that are so diverse and different in the way they think and the things that have influenced them and shaped them into who they are. And also there are a lot of other social dynamics on the ground that make people do what they do. And so when you're coming in with SBC interventions, it is not because you have seen that a certain tradition or culture is not how it's supposed to be, but it's about how can we improve and get them to a different level from where they are. I have also learned that SBC should focus more on awakening responsibility in the intended audience, rather than just highlighting the benefits of the promoted behavior. This comes as a result of understanding that oftentimes, people already understand the benefit of adopting the promoted behavior, but it is the steps and the actions that are required for them to carry out that behavior that they often struggle with. And so highlighting and awakening the sense of responsibility in them in terms of why they need to do this is a step that will actually get people to feel that they need to do it rather than telling them the benefits, because there will always be an alternative benefit that people will always settle for. But if they feel that it is their responsibility and no one else is going to do it, and once they start, they understand that other people will come in and join them, then it's much more impactful in terms of getting people to start working towards a more improved behavior. Then I have also learned that SBC interventions is not SBC intervention is not work. If it's not working, it most likely means that it's not properly tailored to the audience. Audiences are very diverse. You can have properly tailored SBC interventions on paper that follow all the frameworks, but when you actually go into the community, if you have not done your work on understanding the community, having done an authentic profiling of the community that you are doing the intervention on, it will not work no matter how much you have followed all the frameworks that exist. So it's very important that you also consider the supporting systems that are available in terms of aligning your SBC interventions, because without which nothing will actually come out from your intervention, no matter how well it is actually tailored, if it doesn't show an understanding of your intended audience. Then I've also learned that inclusion is more important than just sympathy when designing SBC programs. There are times I think it may be tempting to look at the most in need people within a specific context and tailor SBC interventions for those particular people, and leave out the people that do not necessarily look like they are the ones that need to be engaged. So it's one of the things that I think needs to be really considered in terms of who the key people really are that you need to target. They may not be the majority, but they may be the people that will actually get you to reach the impact that you intend. Then leveraging technology and social media has great potential to enhance future SBC efforts because it allows for reaching wider audiences and enabling more tailored interventions. But also this brings us back to the issue of the cultural influence and the profile of the intended audience. I have learned that there's a bridge in terms of generation that has to be bridged. We have the older generation that listen more or receive more of their information through one-on-one conversations, through community meetings, while we have the new generation that is coming in where they receive their information by the click on their phones. So looking at the different ways in which people are receiving their information and how they prefer to be communicated to, we should always keep in mind that even though we have technology that has given SBC workers the possibility of reaching mass people, it's also about sitting down and looking at what is the best way to reach a specific individual or intended community. And so these are some of the things that I have learned based on the work that I have been doing. Next. Thank you. For younger generations, I haven't been in SBC for a very long time, but one thing that I have learned is the influencer phenomenon that is currently going on actually gives a lot of relevance to the younger generation getting involved in SBC work. The generation that we have now has had an opportunity to learn from old-timers like Emmanuel that are talking about how things used to be and how they are now. But also the new generation has an opportunity to influence things based on how they have learned from the older generation and how they are going about their day-to-day life. So the new generation really have a deep and first-hand understanding of the needs and preferences in terms of communication channels that resonate with not only their peers, but also from their older generation, having learned and experienced some of these. So they are like a very critical stakeholder when it comes to SBC, and their involvement should be encouraged. Then the new generation also offers a certain level of adaptability and innovation, especially now that we live in a technology era where everything in terms of communication is dependent on technology. There's a lot of innovation and innovative approaches that young people have right now, and they are much more adaptable and tech savvy. One example that I always like to give is that if you find yourself as the youngest person in your office, or maybe a Gen Z at your workplace, it's like automatically you work in the IT department. Whenever there's an issue, your boss would always call you to say, can you come and fix this for me? So there's already that tech savvy that is understood, that we're able to influence culture so easily from the way we perceive things, and our understanding is much more broad, because we have somewhere where we can learn from, but while we're also navigating on our own paths. Then the younger generation has a very big multiplier effect. You are all influencers in everybody's ways. Your Instagram, this mass communication era that we're in, simply by typing a tweet, you would have influenced thousands of people that you don't already know start following you and looking at what you're already doing. So when you look at all this, the young people are really critical in terms of pulling in more people to be more interested in SBC work, especially since most people when you're looking at them from a younger generation, they have not been interested in this work. So the more young people we have coming into SBC work, the more we are able to influence people into adopting healthier behaviors and changing society. Next.
Jessica, just a reminder that we have 2 minutes.
Okay, quickly. So my
Sorry.
advice personally, thank you, Farah. Advice for newcomers, I would say always dig deep. Dig as deep as you can in terms of maintain a mindset of continuous learning and exploration in your SBC work. You'll have a lot of challenges that will always mean that you need to continue investigating. And I would actually say always be open to new insights and adjust your understanding as you uncover more information. There's always more than meets the eye. Then empathy is also one of the things that will also come in a lot of times in SBC work. So SBC work enables a deeper empathetic understanding of targeted audience. However, don't ever assume that you have the full understanding of your intended audience, because the barriers or perspectives will still not be as clear to you. In a way, they will elude you. So avoid thinking challenges are too difficult. Then always approach with an open mind and solution-oriented mindset. You can do anything if you put your mind to it. Always have a fresh perspective. Don't feel compelled to strictly conform to established norms or methods. Be willing to explore alternative approaches that could be more effective. New ideas can cover a lot of unseen impacts. Emmanuel, in his presentation, talked about how we've moved from SBCC, we are now at SBC. So things always change and they always start with fresh perspectives. Then traditional and digital mediums, this goes out especially to those of us that are practicing in Africa, that understand that there may be significant generational differences in how different audiences respond and engage with various communication channels, especially the older generations. Always embrace an inclusive approach that considers the preferences of the diverse audiences rather than relying on a one-size-fits-all strategy. Remember that we have people of different generations, our innovations, our perspectives, and whatever we dig deep in should always push us further to develop strategies that are actually going to be sustainable. Thank you.
Thank you very much, Jessica. Whoa, like really, very, very eye-opening presentation. All the insights you provided. I think you can even see everyone on the chat, how excited everyone is. Thank you for your insights. And we will definitely have a couple questions in the Q&A. People want to know more. But now I'd like to introduce our next speaker is Olusina from Nigeria.
Good afternoon, good morning, everyone. My name is Shino. Even though I'm supposed to be a retiree, but I think I'm excited to be amongst my fellow youths today.
The internet connectivity is breaking up a bit.
Can I have my slides, please?
I don't have them. I don't
You
have
don't have
them.
my slide?
No. Do you want to,
How about?
Kemi, do you have them that you can put them in the folder?
That's fine. I sent the slides. Wait a minute.
Sorry, sir.
Oh dear. I sent the slides. It's difficult for me to, wow. It's getting difficult to get a slide. I did send it. Oh dear. All right. Oh no. Okay. No. Sorry. I don't. Jesus Christ. Give me 1 minute, please. Because I was just relying on the fact that I've already sent the slides, and so there should be no problem. All right.
No problem, sir. If you go to the next,
Can you?
I could see it if you
Can
go to your
see the
right.
slide? Can you see the slide?
Yeah, if you go to your right one more time, right now it says
Yeah.
reading
Can
view.
you see the slides now?
Yep.
Can you see?
Perfect, sir.
Can you see? Can you see the slides now?
Yes, it's just your
Yeah.
connection. Yes.
All right. Okay. Can I go on?
Yes, please.
All right. Okay. Okay. So, all right. Thank you very much. Thanks, Johnny, which I describe as an inspiring career in social and behavioral change, from nursing to social and behavioral change. My journey. I'm so excited to be here today because of the fact that I'm not the only one that could have been called for this, and it's my pleasure to share my experience with my fellow youth, like I used to say, and then this is the roadmap. I'm going to look at the transition, my transition from nursing to behavior change. We're going to look at some key principles of behavior change, what matters in SBC, my role, opportunities I've had, and areas of focus. Some encouragement for the young ones to explore SBC as a career option, and the fact that what have taken you here will not be able to take you there. So then I conclude. My journey started from the hospital wards and from the School of Nursing many years ago. I'm not going to read all of this, but just to let you know that it's just to inspire you to embrace your own journey as you explore the intersection of SBC and harness your unique talents to make a meaningful impact because of the VUCA world. It needs your energy, it needs your creativity, it needs your dedication to addressing the complex challenges staring us in the face. And as you navigate your own path in SBC, I want you to remember that career switches like mine are not failures, but stepping stones to success. I want you to get ready to embrace the unknown, learn from failures, surround yourself with mentors and peers who will be able to support and challenge you. Do not limit yourself, because of that British author says, as a man thinketh, so he is. So let us explore the world of SBC together, and may our collective passion and expertise create a brighter future for all of us. Yeah, I'm not reading all of this, but I started in 1979 and then up to 2003. From there, you go on, see 2005 to 2017. That's everywhere I've had that opportunity to learn and unlearn concerning SBC. And when you look at the definition of it, but just to let us know that SBC, or to remind us, just like my two colleagues have said, that SBC and SBC are not the same. While SBC is the broader field that aims to change behaviors and social norms, SBCC is a specific approach within that field, leveraging on communication to achieve those changes. I'm so happy with Jessica's insisting on describing audiences as intended audience. Some of us, we call them target audience. You're almost like reducing them to numbers. So rather than calling them target audience, I like the way Jessica has been emphasizing intended audience. What are the key principles? Understanding behavior, empathy and active listening, evidence-based approaches, community engagement, sustainability and scalability, and so on and so forth. I'm sure the organizers will give us these slides at the end of the day. Then improve health, empowerment, social norms shift, community development, human rights, environmental conservation, education, and personal growth. These are all some of the principles and the impact on individuals and community. Now, what about the opportunities? The opportunities in SBC. For instance, in program management, you're able to design and implement and evaluate the SBC programs. You're able to conduct behavioral, have your hands in policy advocacy, influencing policies and regulations to support SBC-related goals. You're also able to build capacity of people who want to become SBC practitioners or those in civil society organizations who are practicing SBC. What about the areas of focus? You can focus on health, education, environment, human rights, economic empowerment. Now, I've had various opportunities on this journey. On the left-hand side of the screen, I was able to be on a segment of on a media engagement with some colleagues from South Africa when I was in the Nigerian Business Coalition Against AIDS. We were talking about HIV. I had the opportunity to meet with celebrities to be able to advance the cause of SBC using, for instance, like this JJ Okocha. It's a legend in football in Nigeria. We invited him in order to drum up support for SBC when I was in the Nigerian Business Coalition Against AIDS. So we have a raffle draw, and the proceeds were used to support people in the field. And then we can also on the right, the extreme right. You see, there's one of our mentees was decided to take some time to talk about how you can use SBC to tackle corruption as a social problem. So there are several opportunities, like one internationally, regionally, and even locally. And I also had the privilege of attending the Johns Hopkins advances in family health communication. That was 1997 in Towson, Maryland. I've written several abstracts and submitted abstracts that were read, that were delivered at international conferences, as we have seen here. One on mobile HIV counseling and testing services, another one taking opportunity to advance HIV services through organizational analysis guided SBC, and I also talking about reducing stigma and discrimination in the workplace through the what called the JIPA initiative. JIPA initiative, a greater involvement of people living with HIV and AIDS. We pioneered that in Nigeria with the support of the UN AIDS. I also have media opportunities, talking about what we do, especially in the workplace, so that everyone needs HIV program. And every workplace needs HIV program, because when you talk about HIV in the workplace, you are talking about people in the workplace, their captive audience, and the business community. They also interact with the business community. So as we are interacting with them, as we are building the capacity in the workplace, we're also building the capacity of the business host communities, because they have interaction with these people. So it's very important for us to know that human behavior crafting programs. Now, there are some pros and cons when you talk about SBC as a career. Some of the pros, you have in your hands meaningful work. You're able to contribute to improving lives and society. There's a variety of things you can do in SBC. It enhances your creativity because it involves designing innovative solutions and campaigns. You become more collaborative, because in primary healthcare, we talk about a multi-sectoral approach. So in SBCC, professionals will work with diverse stakeholders, building partnership and networks. Then SBC work challenges your professionals to understand human behavior and motivations, thus leading to personal insights and growth. What about the cons? It can be emotionally demanding, because SBC work can be emotionally taxing as professionals confront complex issues. It can have resistance to change, because some individuals and communities may resist behavior change, making SBC work challenging and frustrating. And then when you have limited resources in a resource-constrained community environment, geography, then SBC initiatives can face funding and resource constraints. And then what about monitoring and evaluation and learning department? They always tell us that if you have not documented it, you have not done it. So you need to, when you are measuring impact, you are assessing the effectiveness of SBC intervention. But we also have a case of the issue of attributes. Can you attribute the success? Can you attribute the success story to your own intervention alone? Then there are also another con here is burnout risk. SBC professionals may experience burnout due to high expectations and intense workload. In your quest for SBC as a career, I want you to join the SBC movement, because successful people are future-oriented. You are future thinkers. I want you to be the change that you want to see. Use your skills and passion. I want you to be mad. When I say I want you to be mad, I want you to be positively mad. Make a difference in the world. I want you to explore SBC as a career, develop opportunities in program management, in program research, in program community engagement, program policy advocacy, and much more science in program design and implementation. There is connectivity is very important. According to John Maxwell, it says everyone communicates, but few connects. Network with experienced SBC practitioners and learn from their experience as mentors, and that connectivity will surely shorten your journey to the top as you are willing to learn from their mistakes and pitfalls. Start your journey now. Think big, start small, and act now. Take the first step towards a fulfilling career in SBC, but in order to achieve big things, you need courage, you need boldness. Conquer your fears and take dominion. What are you waiting for at this time? What you are looking for is right inside of you. Begin the search for its discovery. Get ready to give back to it. And when you sharpen your SBC skills, people will be willing to pay your bills. And your additional knowledge will determine the currency in your pocket. I want to inspire you that the future belongs to those who believe in the beauty of their dreams. You must be a great dreamer. You cannot feature in the future that you did not picture. Be the change you want to see in the world. Next step, Visit or search for relevant website, resource to learn more about SBC careers and opportunities. Join relevant social media group, community to connect with veterans and ACE SBC professionals and stay updated in the industry news. According to Maxon, it says, you have within you right now everything you need to do with whatever the world throws at you. And I want to thank you for listening to me and for the privilege of the opportunities I've had over the years. Our call of the global community in driving positive impact. Let us connect. Everyone communicates, few connects. Keep shining. We love empowering young people like you and seeing you become the change makers at the top. Final thoughts, picture your future in SBC. The best way to prepare. You need a mentor to help you navigate your journey more efficiently, avoid detours, and reach your goals faster. He or she can help you hone your skills, build your confidence, and unlock your full potential. Having a great mentor is like having GPS for your career, personal growth, and development. Go out there and future in SBC. So, ladies and gentlemen, I want to thank you very much. This I'm leaving it for you can access in order for you to see to get more, because within the space of time that we've been given, we will not be able to give you everything that we desire to give you today. So once again, I thank you very much for this great privilege to be among my fellow youths today, even though I'm a retiree, as they call me. But I'm a youth because I've retired, but I'm still firing in all the cylinders on SBCC. Thank you very much. Thank you.
Thank you very much. A very, very inspiring talk. You're probably the coolest retiree on here. I think your talk was very inspiring to everyone. You can see in the comments how excited people are. And I would love to, on behalf of everyone, start the Q&A session. I think lots of people have amazing questions, and I'd like to begin with the questions in the Q&A section. If anyone wants to add any questions, please do. Unfortunately, we don't have a lot of time, but this amazing panel needs to be extended with a couple of questions. So let me start off with this question right here. Okay, someone was asking, how sustainable is the private sector funding sustainable against slow pace of challenge results? Can we build on local and indigenous resources to impact more and achieve sustainable impact? Any of the panelists can just jump in and answer if you'd like.
Maybe I can start and then someone else.
Well, I had the privilege of working in the private sector. All right, go ahead, Emmanuel.
Okay, so what I'll say is that as we said from the beginning, behavior change is a process. In the beginning, private sector wasn't involved at all. So now what we are saying is, from where we've come from, let's get them involved. Let's get private sector to commit to supporting SBC initiatives. So it's going to take time. It may not be enough, but we can build that over time. Because I know when we were running a campaign on LLIN, one of the arguments we made was the fact that productivity is directly linked to malaria. So the more your staff gets sick of malaria, the lesser your productivity, which is going to affect profitability in the long run. Initially, it was difficult, but with time, they were able to understand, and some of them start even buying the LLINs and then distributing and sharing among their staff. So yes, beginning may be challenging, it may be slow, but we cannot stop. We need to build on that and move it forward. So that may be my initial comment.
Thank you. Thank you very much for this informative answer. I wanted to ask Jessica a question about how she learned about SBC and what motivated her to join the field. I think your presentation was quite inspiring, so I think everyone wants to know your story of how you chose this path.
Okay, thank you for that question. So how I chose the path is more of, I didn't even know that I was getting into SBC, to be honest. I've always just had this interest in people. Initially, I thought I wanted to do anthropology. I've always been somebody who's been very interested in mindsets and the effects of how people think and how they act. So for me, when I was choosing a career path, I remember one of my options was to end up in a bank, but I decided that no. So I ended up staying for a very long time without employment because I wanted something that was people-centered, something that I could get to interact with different people on different issues and just get to see how they navigate around those issues and the impacts that come out of that. So when I had an opportunity, I got my first, I got an internship working at Central Statistics, where I ended up doing a lot of research with different organizations. And from then I decided that SBC is something that I wanted to go into, and took a deliberate step of doing a master's degree in communication for development, because it always just felt personal to me. And most of the issues that actually society struggles with, they stem from how people reason and think about certain things, and just not having enough information to help them along as they make decisions. I felt like that would be a critical move for me to contribute in my own way. So it was, yeah, that was mainly it, just a personal interest.
Thank you very much. An inspiring answer as expected. Moving on, we need to close the session, move on from this panel as soon as possible, but I'd like to ask one last question to Olushina, because I think everyone would love to know what you found the most fulfilling about your career in SBC following this inspiring and motivating presentation. Would you like to share your answer with us? I hope your internet is stable. Okay, I think we lost him to the internet connection. Okay, so let's move on. Very, very exciting panel discussion, very motivating and inspiring presentations by all of you. Thank you very much. And this is a reminder to everyone to share more on the Q&A in the Q&A section, and to be more proactive on the chat. We'd love to interact with you even more. And this is something I'm personally excited about, is to introduce Kevin up next, who will share with us a creative poem about the summit. Kevin, the mic is with you.
Thank you so much, Farah. I'm going to try to share my screen.
We can see your screen.
Please let me know if it's in presenter mode.
We can see it. All's good. You can go ahead.
Okay, cool. Thank you. My name is Mbugua Kimani, Kevin. I'm from Kenya, and I'm gonna share a poem that I wrote. I'm gonna recite it for you today. So the poem is titled "To Live with No Questions." To school I go, many miles from home. The burden on my back, all the way and back. The journey is tough, a lot in the dark. It's easier the option, but there's no turning back. A future I seek, of which I cannot speak. I whisper to the trees, my tidings to keep. For rage boils my blood, for sores invade my feet. For my body accepts defeat, but my spirit cannot deplete. To live with no answers, terrified of questions. I walk it all off for a good impression. But it kills me, my conformity, my growing silence, my complacency, my hesitance, my latency, taking away my decency. So I stride on seditiously, my whispers now loud, audaciously, breaking away decidedly, questioning undoubtedly. Thank you. Back to you, Farah.
Thank you very much, Kevin. Very heartfelt poem. I think everyone will agree with that. I think it's just the kind of inspiration we all needed. Moving on to our next panel, since we're already behind on time. This next panel discussion is with an aim to bridge the gap from campus to career. So without further ado, let me pass on the mic to this session's facilitator, Valdermiro from Sightsavers.
Hello.
Hi, yes, we can hear you.
Okay, thank you so much. Thank you so much. And I'm really happy to join you this afternoon. In our next section, we'll be having some insights on from campus to career, navigating the SBC job landscape. And we are happy to welcome Silui Nafora and Angela Shitsim, who will be giving us in few minutes some insights on this topic. Silvina Fora is a doctor in communication and development, and she is also the author of the book, which is entitled Communication and Well-Being, HIV Positive People in Ivory Coast. And in the other hand, we have Angela Shitsim, who is a senior social behavior change technical advisor at Sightsavers or at Save the Children, based in Malawi. She has over 14 years working experience in SBC landscape, and she specialized in integrated health SBC programming and resilience food security activities with extensive experience in communication strategy. So we will start by inviting Angela Shitsim. Then we will go to Silui Nafora. Each one of them will be having 10 minutes. Then we will have the section of question and answers. I would encourage all of you or all the participants to write the questions and comments, all your contributions on the chat, so that by the end we go through them. Thank you so much. Over to you, Angela. We have your presentation already. Angela, can you hear me?
I see Angela's video on. Angela, you're still muted.
Yeah, I trust she's speaking on mute. Can you hear us, Angela?
Yes, I can hear you.
Thank you so much.
Good. Good morning and good afternoon, everyone. All right. I hope you can hear me now.
Yes, we can hear you.
Great. All right. As mentioned, the topic that I'm going to speak about is on navigating the SBC job landscape, why SBC is a lucrative career choice, and the resources and opportunities that exist within this field. So I'd like to start off by saying SBC works. Most people want to be associated with something that works and makes a difference in people's lives. Apparently, there is scientific proof that we have an innate desire to make a difference in the world. And the more we care about the happiness and the well-being of our fellow humans, the happier we get. And being in the SBC field for the past 14 years has offered this fulfillment for me. SBC Works is a slogan or term I've borrowed from UNICEF, which is its initiative to showcase that SBC works through the documentation and sharing of SBC success stories in Eastern and Southern Africa. There has been a growing recognition of the critical role SBC plays in achieving global development goals. The SBC landscape continues to evolve and grow, mostly used in the health sector. SBC is now sought anywhere and everywhere, and its relevance is being realized in other sectors, including education, nutrition, agriculture, democracy, and governance, and within the humanitarian space and more. There's a greater interest among donors, governments, and funders in investing in SBC initiatives. It is a cross-cutting discipline. As such, a career in SBC makes you relevant and marketable in any development sector. I personally have predominantly worked in the health sector and recently moved to the resilience and food security space. And the principles used are predominantly the same. Effective SBC requires a skilled SBC workforce. Having SBC practitioners with requisite skills and competencies contributes to high quality SBC implementation, resulting in positive outcomes. An assessment conducted by Soul City project in 2009 found that most practitioners responsible for SBCC in Africa did not have the relevant training. In Malawi, a similar capacity assessment of national and district level government health promotion officers, as well as local NGO staff, which was carried out in 2017 by a Health Communication for Life project, found that the capacity to plan and design, monitor, and evaluate, as well as scale up SBC, was low. I want to take some time to reflect on my own personal SBC journey. I started off with no SBC training. I can say that I landed in the SBC landscape by accident. My first degree is a Bachelor of Social Science majoring in politics and history. And one of the first notable SBC projects I was privileged to work for was called the SSDI Communication Project under Johns Hopkins University Center for Communication Programs. I started off as a zonal coordinator. This is where I got most of my community mobilization and mass media experience. And I later was privileged to work under Wits University, which is a center for excellence in SBC, and worked with some of the best SBC experts the continent has to offer that have coached and mentored me. And my capacity was also strengthened through participating in SBC learning and sharing forums, such as SBC technical working groups at national as well as global levels, and platforms such as the Springboard for Health Communication Specialists, and of course, platforms such as this one. Then there's, of course, the Campus for SBC that has been my go-to platform for how to do guides on things like strategy as well as message development and more. And of course, now there are many other platforms such as these that are useful for SBC practitioners or anyone wanting to delve into the SBC space. Then eventually I decided to do an MPH specialized in SBC with the University of Witwatersrand. So previously, SBC may not have been recognized as a defined career choice, but there has been impressive strides towards elevating the status of SBC practitioners into a well-defined profession. There have been SBC courses and programs that have been introduced. For example, we had the Sea Change project that established a Center for Excellence at the Witwatersrand University, which was the first accredited graduate level SBC program. In Malawi, through the Health Communication for Life project, Witwatersrand University also worked with local academic institutions to design and offer short SBC courses to SBC practitioners. And they had what they called the Set for Change initiative, which was to support SBC practitioners to move from theory to practice by applying what they learned in the short SBC courses into their day-to-day work. Currently, Malawi now has a Master's of Arts in Health and Behavior Change Communication offered by the Malawi University of Business and Applied Sciences. The University of Nairobi as well, in collaboration with UNICEF, launched 2 short social norms courses on keeping children safe and reducing harmful practices that impact children. And there are many more other such opportunities and SBC courses and programs. We also have some online SBC courses. We have the UNICEF Social and Behavior Change Theory and Practice, the SBC Health Campus. We have the Leadership and HCD Certificate Cohort and Self-Paced courses on IDEOU, Breakthrough Action SBC Learning Central, Save the Children, also in partnership with other stakeholders, has developed several SBC guidance documents on strategy development, strengthening SBC for family planning in fragile and humanitarian crisis settings, and a collection of SBC resources designed to improve SBC programming for resilience, food security, activity implementers, as well as SBC practitioners. There are also a lot of SBC fellowship and internships available. Many SBC projects offer fellowship and internship opportunities. I found that Impact Pool as well as LinkedIn are great career websites that one can go to find these opportunities. And of course, we have the SBC Exchange events and forums, such as the Springboard for Health Communication Professionals, SBC Summit, such as this one, and SBC technical working groups that are quite useful. So what is my take-home message? Firstly, a profession in SBC is relevant and marketable in any development sector. Secondly, working in the SBC field brings personal fulfillment in contributing to positive changes at various levels. And lastly, your academic background should not deter you from venturing into the SBC landscape, as there are many pathways and opportunities for building skills and competencies in SBC. So thank you very much for this opportunity to share with you some of my personal experiences in the SBC landscape and my personal journey. Thank you. This is what I had for you today.
Thank you so much, Angela, for this encouraging presentation, encouraging and insightful presentation. I can see the reactions on the chat. So now we are going to invite Silui to present. Thank you. Over to you, Silui.
Merci. Je suis là. Bonjour à tous et à toutes.
Bonjour, bonjour, bonjour.
Alors, je suis docteur Silui, comme j'ai été présenté tout à l'heure par le modérateur. Et donc, je vais vous partager mon expérience du campus à la carrière, naviguer dans le paysage de l'emploi SBC. Donc, je vous viens de la Côte d'Ivoire. Et donc, on va passer le plan. On va aller directement à l'introduction. Diapo suivante. Alors, la transition du campus universitaire à la carrière professionnelle est une étape assez déterminante et souvent très complexe de la vie des jeunes diplômés. Bien au-delà des différents défis traditionnels qui sont liés à l'intégration dans le monde du travail, cette transition se déroule dans un contexte de transformation sociale et comportementale assez profonde. Au cours de mon propre parcours, j'ai été témoin de l'impact du fossé entre la théorie et la pratique. Et donc, ce qui a suscité de nombreuses questions relatives aux différentes attentes des employeurs sur est-ce qu'on sera à mesure, quand on sort de l'université, est-ce qu'on est à mesure de pouvoir offrir quelque chose à une entreprise ou encore à un organisme. Et donc, ces éléments aussi ont été influencés par l'absence d'un cadre formel de mentorat qui peut également guider les plus jeunes formés qui viennent de sortir des universités. Pourtant, avec les différentes mutations de nos sociétés, une mutualisation des compétences serait vraiment un atout et une solution pour répondre aux différents changements sociaux. Diapo suivante.
Can you move to the next slide, please?
Alors, comprendre le SBC, mes prédécesseurs l'ont déjà très bien présenté. Donc, le SBC fait référence à toute une activité ou un ensemble d'activités ou encore une stratégie qui permet de favoriser l'adoption de comportements sains ou encore de comportements jugés bénéfiques pour la société. Et donc, le mot social va aller au-delà de l'individu et va prendre en compte le contexte de l'environnement dans lequel vit cet individu-là, parce que c'est ce contexte-là qui peut influencer cet individu en vue d'empêcher le changement. Du coup, le domaine des SBC va prendre en compte beaucoup d'autres aspects. En plus de l'éducation, on a la santé publique, on a les technologies, on a l'environnement, la durabilité, on a également les questions de justice et de droit social. Et dans le SBC, on a 2 éléments fondamentaux qui sont le processus P, qui est un cadre vraiment important pour nous aider à guider la planification de nos programmes SBC, et également le cercle d'influence sur le comportement qu'on appelle généralement l'approche socio-écologique, qui va nous décrire un individu dans un environnement qui est pris en compte, qui est pris sans en compte l'environnement, ne peut pas changer parce qu'il a l'influence de l'environnement sur lui. Diapo suivante. Ou est-ce qu'on me laisse présenter moi-même parce que voilà. L'élément suivant, c'est mon passage du campus. C'est-à-dire le temps que j'ai passé au campus a été le temps de formation. Pour moi, ça a été cette formation a été très importante parce qu'elle elle m'a accentué une formation en communication. Je suis communicologue de formation. Et donc, pour dire que pour faire du SBC, on peut faire de la communication, on peut faire au-delà de la communication, on a la sociologie, on a l'anthropologie, on a la psychologie. Et on peut également faire le SBC sans forcément faire l'une de ces filières-là. Alors, les cours étaient vraiment assez orientés sur les techniques de communication, les théories de la communication, la sémiologie de l'image, les stratégies de changement de comportement, la communication des organisations, la communication pour le changement de comportement qui est devenue communication pour le changement social et de comportement, les médias et société. C'était vraiment tout un ensemble de matières qui nous ont donné vraiment la base essentielle pour exercer le SB6. Alors, la transition s'est faite, ma première expérience dans la transition s'est faite à travers un stage. Alors, le stage que j'ai eu était à mon année de maîtrise. Après la maîtrise, j'ai cherché à rentrer dans une organisation et je suis allée tenter mon expérience au niveau du PNLS. Le PNLS, c'est le Programme national de lutte contre le sida. L'occasion pour dire ici qu'au niveau de la Côte d'Ivoire, le ministère de la Santé et de l'Hygiène publique a au moins une vingtaine de programmes nationaux de santé. Et donc, c'est des LUCAN, c'est des cadres qui nous permettent vraiment d'exécuter ou d'exercer le SBC dans toute son entièreté. Au-delà des stages, on a le bénévolat. Le bénévolat, on peut le faire dans un organisme national, dans une institution internationale, telle que le système des Nations Unies, UNICEF, PNUD, ONU-SIDA, et même les ONG nationales comme les ONG internationales, telles que Alliance, FHI 360, John Hopkins University, qui a sa représentation avec le projet Breakthrough Action, ainsi de suite. Au-delà de cela, on peut s'affilier également à une institution de recherche pour faire des activités de recherche et qui nous permettent d'avoir une expérience terrain dans les unités de recherche ou encore des activités qui pourraient être lancées par une institution auquel on veut participer. Cela nous permet vraiment d'avoir plus, de comprendre les défis en fait du dynamisme local. Et l'autre chose, c'est le réseautage académique. Généralement, quand on sort des universités, on n'a plus de contact avec nos universités, ce qui est une erreur parce que rester en contact avec l'université nous met dans un réseau. D'abord, cela nous maintient en contact avec nos supérieurs, nos enseignants, qui sont pour nous comme des références, des personnes ressources en cas de besoin qui peuvent nous éclairer la lanterne et qui nous permettent également de pouvoir être guidés dans la prise de nos décisions relativement au choix d'exercice dans le SBC. Avançons avec la diapo suivante. Alors, mon passage au PNLS, qui est le Programme national de lutte contre le sida, diapo suivante, m'a permis d'exercer vraiment des activités de communication, des activités de sensibilisation, des activités d'élaboration de messages de support de communication qui ont servi à faire de la sensibilisation dans la Côte d'Ivoire entière et même au-delà. Et sur toutes les thématiques, que ce soit la prévention de la transmission mère-enfant, que ce soit sur le dépistage, que ce soit sur l'approche I égale à I, que ce soit également sur les questions de stigmatisation et beaucoup d'autres domaines. Nous avons participé à des projets tels que le MTV Sugar Baby, qui a permis vraiment d'utiliser la cible jeune pour sensibiliser. Et donc, cette expérience m'a vraiment aidé à lier la pratique de la théorie ce qui me permet aujourd'hui en tant qu'enseignant-chercheur, parce que ce que je n'ai pas dit, c'est que étant au programme national de lutte contre le sida avec le niveau maîtrise, cela me permettait de continuer la recherche et de soutenir un doctorat. Et donc, le doctorat en sciences de la communication, option communication et développement, est un doctorat qui est donné dans la spécialité, en fait, SBC. Du coup, la pratique que j'ai faite étant dans le programme national me permet aujourd'hui de pouvoir analyser et identifier le besoin de formation pour des étudiants en SBC. Cela me facilite la conception de modules de formation. Exemple, les questions de stratégie d'élaboration de messages et de support de communication. C'est toute une dynamique, c'est toute une suite logique de choses que le programme m'a permis de pouvoir vraiment implémenter et pratiquer au maximum. Aujourd'hui, avec du recul, c'est beaucoup de consultances que je peux faire en appui aux différents projets qui sont sur le terrain dans la lutte contre le VIH-Sida. C'est les accompagnements du programme ou encore d'autres structures que je peux faire, et également le monitoring ou encore l'appui des étudiants qui sont encore dans la spécialité qui ont besoin. Quels sont les conseils que je peux apporter aujourd'hui pour développer sa carrière dans le SBC? La première des choses, c'est d'abord la formation. Il faut obtenir une formation solide dans le domaine. Et si on n'a pas obtenu de formation telle que dans les domaines que j'ai cités plus haut, on peut participer à des programmes de formation spécifiques sur le SBC. Ici, en Côte d'Ivoire, on a les cours de leadership en communication stratégique. Et cette année, je pense que c'est lancé à partir du 9 septembre 2024. Les cours vont commencer et c'est fait par Breakthrough Action ici au niveau pays. C'est un important programme qui vraiment vous enseigne sur le SBC et c'est à travers ce programme que j'ai compris ma formation universitaire que j'avais fait dans le SBC sans savoir sur à quoi ça pouvait servir concrètement sur le terrain. Il va falloir développer ces compétences aussi dans d'autres domaines connexes tels que l'analyse des données, la gestion des projets et la sensibilisation. Il va falloir gagner de l'expérience à travers les stages, les projets de terrain et aussi la participation à des forums tels que celui qu'on est en train de faire présentement. Il est important également de créer un réseau à travers ces différents séminaires, ateliers et l'adhésion à des associations de praticiens où se trouvent des mentors qui vont pouvoir nous guider. Diapo suivante. Il est important également, la diapo suivante, de faire des publications de notre expérience passée à travers des blogs, des publications de livres. Moi, dans mon cas, j'ai pu publier un livre, j'ai publié des articles sur la PTME, j'ai publié, il y a un article en cours d'élaboration sur l'utilisation des TIC dans la sensibilisation des adolescents et jeunes contre le VIH-Sida en Côte d'Ivoire. Il est important, au-delà de ce partage d'expérience-là, de pouvoir se former continuellement en participant à des webinaires, pour rester à la pointe des meilleures pratiques dans le SBC, comme présentement ce qu'on est en train de faire, de lire des publications, des livres, des articles, des rapports sur le SBC et aussi de s'adapter au TIC dans un contexte local. Diapositive. Pour conclure, nous pouvons retenir en conclusion que...
Really sorry to cut you off. We just need to wrap it up as soon as possible.
Voilà. La conclusion, c'est que la transition du campus à la carrière est un passage complexe et déterminant pour les jeunes diplômés. Et donc, les compétences et les connaissances acquises pendant les études sont essentielles, mais doivent être continuellement adaptées. Et donc, la volonté d'apprendre continuellement en recherchant des mentors et en participant activement à des initiatives de développement professionnel, les jeunes diplômés peuvent mieux naviguer dans cette expérience de transition et contribuer également de manière significative aux transformations sociétales. Ainsi, du campus à la carrière, chaque étape reste une opportunité d'apprentissage et de croissance. Et en s'engageant activement dans le contexte social et comportemental, les jeunes professionnels peuvent non seulement trouver leur place dans le domaine du travail, mais ils peuvent également devenir des agents importants de changement de nos sociétés. Je vous remercie.
Thank you very much, and I'm really sorry I had to cut you off. Thank you, Valdemiro, for this talk and for to all our panelists. Unfortunately, I've been asked to cut this panel short because we're very late on time. So we won't be able to have a Q&A right now, but all the panelists are encouraged to answer the questions on the Q&A section. And as usual, you're all encouraged to share your thoughts and your questions in the chat and the Q&A section. And I'd like to pass on the mic to Derek from Kenya, who will give us a quick talk about harnessing ICT for SBC with focus on young people. Thank you, Derek. The mic is with you.
All right. I really appreciate. I hope you can hear me loud and clear.
Yes, we can hear you and we can see your screen.
Okay, perfect. So I think when the team reached out to me to be able to contribute, I was, overly delighted to, participate with this topic, especially, based on my experience and what is happening in Kenya as we speak. So my name is Derek Gaku. I'm a technologist. I'm currently, product manager for a payments app in Kenya called Payless that targets, young people. We are giving them a tool to be able to, to do their transactions, and more than that, to be able to participate in the digital ecosystem of value creation and earn and spend how they want. But apart from that, I've also been involved in technology in so many other ways. So this is a really interesting topic for me, having in mind, the intersection of technology, young people, and change. So, maybe just a bit of context, of ICT and how we understand it. This technology means different things to a lot of people, but in a nutshell, digital technologies can be leveraged to enable young people to access, retrieve, store, transmit, and sometimes manipulate information. The practical use cases, applications of ICT in our everyday lives is from internet and web applications. That is how the consumer side, how we consume technology. Supply side, we have the server network. We have that sort of enterprise. We have mobile technologies, computing devices, telecommunications, software applications, gaming, and gaming is actually one of the key ways in which young people interact with technology today. And nowadays, you hear a lot about gamification in terms of, let's say, financial literacy and how to shape that type of behavior. But very particular, use cases or applications in social behavior change. We're looking at how do we take advantage of some of the technology, tools that are available to us to be able to shape narratives, which is primarily communication in the digital spaces. How do we, analyze sentiment, the resultant sentiment? How do we target, how do we encourage content creation? Content creation is massive today, but how do we encourage content creation that is also targeted in the type of behavior that we want to be able to shape, and all these geared towards, changing groupthink and identity. So in a nutshell overview, we see, mobile penetration, for example, for Africa today is very, very encouraging. Africa is super, youthful. Average age is 21 years. Youngest country is here in Africa, that is Chad. What it means is that we also have a demographic that has been born into technology, that has been using mobile devices to be able to access information, to be able to learn very different skills, from software engineering to even just practical courses that are taught online on how to do very different things, including engineering and extreme use cases like aviation, even to creative, like creating content and being able to monetize this particular content. We have seen how young people are leveraging some of these technologies to be able to collaborate in very different ways and co-create. We have a lot of edtech platforms and digital learning platforms, engagement and participation. And let me just pause here. Right now we have some sort of conversation happening in Kenya about better governance and how young people can be involved in things like how parliament and how government goes around its policy, the financial bill taking the center stage. And all these conversations started in the digital spaces, that is Twitter, Facebook, and to a greater extent, TikTok. And this sort of just paints how powerful and how massive these elements of ICT, creating that sort of enablement for for these people to be able to air their views, to be able to push, and sometimes to be able to demand their voice to be heard. So this has really gained momentum, and the conversation still being shaped in this digital space, and not in mainstream traditional media or legacy ways of conversations, but really digital spaces. And just as late as yesterday, the other day, the president of Kenya agreed to actually participate in a Twitter space and have a conversation with young people in platforms that they consume most. But from that, we can also see how technology, can be used to, bring about monitoring and evaluation of the particular change, behavior change. And some of the monitoring and evaluation applications will be, surveys, sentiment analysis, which is analyzing sentiment regarding very different topic or very targeted topic. You can also look at, participation from young people by directly involving them in digital spaces to answer questions about the efficacy of very specific topic. But most importantly is how then do we leverage technology to bring about reward? Because one of the things that we have even learned in our own digital products that we push to market, taking advantage of digital spaces a lot, is that young people want to see what is in it for me. What's the reward? What do I get if I adopt this behavior? How is it really affecting my bottom line? And mostly you're looking at opportunities for employment opportunities, for how reward is involved on all this. But we can't talk about the role if we don't talk about how do we create that environment. For example, today, a lot of the conversations that are happening in Kenya and how young people are being, are pushing to be involved in governance, also because there has been freedoms of expression and how they can be able to use these particular spaces. So we're looking at, taking advantage of physical infrastructure like ICT hubs, but most importantly, cyberspaces, virtual spaces, virtual cities, because what it means is that a young person in Nairobi, Kampala, Kigali, West Africa, South Africa, can participate in a conversation like the one we are having by taking advantage of this sort of enablement. Access, how do we make sure that access is prevalent? In this sense, we're looking at mobile phone penetration, internet penetration, increased connectivity, and I think a lot of players, for example, in Kenya, have really pushed to for internet access, penetration up to levels of, I think, between 60 to 70%, which means no one person, at least 6 out of 10 young people, can be able to participate in a topic without being excluded. We're also looking at cybersecurity and compliance, which is very important. What it means is, again, taking an example of the conversations that are happening in Nairobi today. A lot of part of what has been happening during that digital conversation is that, young people or people participating in these conversations have also had the threat of being targeted, for their voices, right? These digital spaces also come with a lot of cyber espionage, sometimes ill-intentioned cyber espionage, targeted, harassment, and all these things. So as we take advantage of these tools to be able to create and shape conversations behavior, how do we make sure that, the people participating in them are also doing so in a safe space that is also, compliant and is not taken advantage of, to be able to bring about fear, intimidation, and as well as harassment. And this, of course, is tied to my next point, which is the cyber governance, security and privacy. We are just, as a continent, we are just taking strides into customer or data privacy, and a lot of players in this ecosystem feel like we're not mature yet when it comes to how we handle
Eric, I'm really
data.
sorry to cut you off, but this is just to remind you that we have 2 minutes.
Not a problem. Thank you. Thank you very
Thank
much
you.
for the reminder. I'm just winding up. Apart from privacy, how can we then create communities of people, and people somehow always have some sort of alignment leadership. So how do we take the agents of change and put them in spaces to shape conversations? Also, very importantly, is to see what has worked elsewhere and be able to learn from it and apply it. And that is what case studies and benchmarking will then be used. And there are very, very interesting case studies of how digital spaces or technology has been used to be able to shape conversation in different markets. And most importantly, in summary, is to looking at how do we encourage bottom-up youth-led initiatives for change? How do we then live, if it's EdTech content, how do we have it being UGC? UGC is user-generated content that is coming from the people themselves and creating the sort of influence within the immediate environment. So there's so much opportunity, and the good thing is that ICT tools are not very new to young people on the continent, and it's something they can take advantage of to be able to push different communication and narratives around change. Thank you very much for listening to me, and a pleasure. If any questions come up, happy to answer in the chat. Thank you.
Thank you very much, Derek. And yes, I do encourage you, and I encourage everyone else to answer any of the questions in the chat and in the Q&A. Let's keep the excitement going, everyone. And now we have a panel discussion hosted by JSI with a theme of transforming change pathways with technology. And it's going to be facilitated by Muthoni from Kenya. Muthoni, I pass on the mic to you.
Thank you very much, Farah, and good morning, good afternoon, good evening, everyone. It's a pleasure to see so many organizations and countries represented here. What a powerful session by Derek on harnessing ICT. And in relation to this, you will hear later from one of our panelists from Girl Effect, how they've operationalized the use of technology to inform, educate, engage on young people's SRHR services and products. My name is Muthoni Walkira. I'm the director of the HCD Exchange at JSI and will be moderating this session today. For those who are new to JSI, we are a global nonprofit dedicated to improving the lives around the world through greater health, education, socio-economic equity for individuals and communities. Our SBC work is implemented through the Behavior Initiative, which integrates behavioral thinking into everything we do at JSI. In 2022, we acquired the Manos Group, and we are now 90 SBC specialists in 18 countries. Our recent and current SBC work spans 28 projects across Africa. Now, today for our panel discussion, we have our running theme is Transforming Change Pathways with Technology, where we will learn more about the experiences and impacts of digital tools and platforms in improving and scaling SBC interventions. We have our experts from Sugo Health, who will take us through the results of a random control trial from the application of the Akoso AI engine for predicting and selecting the most effective set of interventions for change. We will also hear from Girl Effect, who will share SBC implementation experience from the award-winning Wazi, which is a chatbot platform in Kenya for youth SRH discussions. And finally, we will hear from JSI, where we will learn more about how behavior change interventions embedded in digital health interventions improve service uptake and influence desired provider behavior. During this session, we'll discuss outcomes and key learnings from these projects adopting technology for SBC, including AI, social media, chatbots, and mobile tech. We will also explore the future of opportunities for technology to predict and influence change pathways, including innovative ideas on the drawing board. So look out for that. And finally, although we have a session dedicated to Q&A, I'd like to encourage you to post questions as they come up, and we'll address them during the Q&A session. Now, I'd like to introduce you to our panelists today. Mokshada Jain. She is a director of global health at Sugo Health. She has over 10 years of experience in using innovative research and data science approaches to improve performance of health programs and products. She has a keen passion for designing tools and solutions that are user-centric, simple to use, implement and scale, and catalytic to existing intervention efforts. Mokshada oversees Sugo International Initiative, ensuring they are a leading edge and in sync with policy and plans of partner organizations, country governments, and communities. Ms. Nancy Njoki, a program lead at Girl Effect. She is a seasoned professional with over 10 years of experience in designing and managing health programs, particularly in sexual and reproductive health, malaria, and child health. Her approach prioritizes placing user at the core of initiatives, aiming to meaningfully and enduring impact. Ms. Njoki actively participates with both national and county governments, contributing to policy agendas that shape implementation strategies, particularly benefiting girls and women. And finally, we will hear from Dr. Tariku Negato, who has over 20 years of experience and has served as an advisor to the Ministry of Health in Ethiopia on maternal and child health research. He initiated and led the development of Ethiopia's national strategy for mainstreaming gender within digital health and health information systems, designed and conducted studies that informed strategic directions and investment, and made significant contributions in the revision of Ethiopia's national HMIS indicators in multiple rounds. He now serves as a Deputy Chief of Party in a flagship USAID-funded digital health activity implemented by JSI. Welcome, panelists. I'll now hand it over to our first panelist, Ms. Mokshada Jain. Over to you, Mokshada.
Excuse me, just one moment. Just if you can make sure that you're speaking loudly and and slow down a little bit. Our interpreters are having a hard time hearing. So if you can just make sure that you speak up a bit into your mics, and if you can slow down a little, that would be helpful. Thank you.
Thank you, Farah. Over to you, Mokshada.
Great. Thank you, Mutani, for the wonderful introduction. And hello, everyone. I'm Mokshada Jain from Sugo Health. Really appreciate all of you joining today. And I'm very excited to be here with my co-panelists to share more about how we've been using technology to determine change pathways and to shift behaviors. So as part of our work, I will be sharing a case example that we've done in family planning in central India, which, most importantly, we are currently in the process of scaling up in a multi-country project, again in family planning across Senegal, Cote d'Ivoire, Nigeria, Ethiopia, and another country in Asia, which is Pakistan. Next slide, please. Thank you. So before I get into the specifics, I want to provide a quick overview. So the technology in discussion today in our context is our causal engine, which we call WISE AI. And WISE AI uses state-of-the-art machine learning algorithms on the data to derive, what are causal drivers of an outcome and its pathways. And I'll show in the next set of slides that how, it is somewhat different from traditional models that you may be familiar with. And we've actually seen, a fair amount of success from the results of this causal engine. An intervention that was based on these models led to a 3x increase in family planning uptake of effective contraceptive methods in central India, which otherwise had been quite stagnant over many years, and more to come here in the presentation. And currently, like I mentioned, we are scaling this work in and the use of this technology in Africa. All in all, we've used this to help stakeholders make prioritized strategic investments. We're really helping them pinpoint what are impactful interventions that they should focus on. And we've done this work across multiple health contexts, such as reproductive health, maternal health, and infectious diseases. Next slide, please. Great. So just setting some quick context, in the countries that I mentioned, in Africa and also in Pakistan, like the big challenge is that contraceptive adoption remains quite low. And we are using this technology to really unlock and understand the why. So there, as we know, some women have the need or the intention to use family planning methods, but women actually face a range of challenges, from whether it's access to agency to social norms and so on, right? And really a key gap that often, program implementers face is that what is that pinpointed information about whom to target, when, and how. Next slide, please. Yeah, next slide. Great. So now, in order to get this pinpointed intelligence as a first step,
Can
we
you please
selected
get closer to your mic? You all of a sudden are in a bit of a tunnel.
Is this better?
Yes, thank you.
Okay, great. So yes, what I was saying is now in order to get this pinpointed intelligence, as a first step, we collect comprehensive data where we leverage our behavior science tools to holistically look at all drivers of a particular behavior. And then we get in and apply our advanced AI and machine learning technologies, which allows us, like I said, to uncover the why and generate causal drivers of behavior. And then using finally these tools and insights, we design precision solutions that helps programs really identify what are the right levers and strategies to implement. Next slide, please. Great. So now on your, I just want to provide a snapshot about our WISE AI technology. Obviously, there are a lot more details, but we will not be covering that today. But if you're, familiar with some of the predictive machine learning models, such as say regression, what it tells you is that what are the factors that correlate with an outcome and treat pretty much every predictor as the same. Whereas, in the causal engine that I said, uses some advanced machine learning algorithm, establishes the structural causal pathway leading to an outcome, highlighting, what are some important upstream and downstream variables. Next slide, please. Next slide. Excellent. So, now I will show you how we've applied our causal engine on our data to generate these intervention levers that can help accelerate contraceptive uptake. So we use these insights to design and evaluate a postpartum family planning intervention, which was driven by community healthcare workers among first-time mothers. And just for some context, these women in India had heightened need to use a family planning method because they did not want to get, they wanted to space their pregnancies. But really the problem was that they weren't using effective modern methods. So while this model may look complicated, I will focus on the roadmap it provides for solutions. So these dark lines show what are the direct causal factors that drive all the different upstream and downstream variables. And eventually at the bottom, there is a family planning uptake outcome, which was of interest. And the yellow circles are really the key causal drivers. So basically, the solution roadmap really told us and the programs in terms of, how do we intervene, at what time, using which channel, and what are the right set of solutions to provide. So what we found was that connecting sometime after birth to provide family planning advice was a big causal driver, and in our context was happening in. The second was that, CHWs are actually a right channel to provide family planning counseling. Again, the program was not sure whether they are the right channel, but actually CHWs are an important touch point. They have access to these women are very important in terms of playing a role to mobilize them for family planning services. Also, awareness, not just of the methods, but where to access them was a really important factor. It was also important to go beyond your close circles, like your spouse, for example, and interact with others to get family planning information. And there were some other secondary factors, such as improving safety perceptions and building confidence that women can obtain family planning methods if they would need to. So based on this, we designed an intervention. So next slide, please. So basically, we designed an intervention based on these causal insights and evaluated them using an RCT in 2023. And the treatment arm received, the CHW counseling and behavior change communication based on the causal drivers in the model. Next slide, please. If you can focus on, the chart on the right, really in terms of outcomes, we saw pretty useful impact. So we saw that for almost, as you can see, this flat line, for a couple of decades, the use of effective contraceptives in our geography was almost under 5%. and it was 6% during baseline. And after the intervention, uptake increased 3x times in the treatment arm to 18%, which was, a big departure, breaking, the rigidity that we saw as part of the older trend. Next slide, please. And then, we also saw very high adoption by community healthcare workers, and they found this intervention to be very useful. So you can see as compared to the treatment, as compared to the control areas in the treatment, in the end line, both CHW visits and most importantly, family counseling was much higher. So if you look at the top right, it was 87% received family planning counseling in the treatment arm versus only 28% in the control arm. Next slide. So, we're very excited finally that as we speak, we are scaling this approach and this use of technology in our current project in, select geographies in Africa. And really the goal is to inform government strategy and programming. So thank you, everyone. I look forward to responding to your questions and passing it on to my co-panelist, Nancy Jokey from Girl Effect.
Thank you, Mokshada. Thank you for that initial presentation. So I will take you through Girl Effect and our work. Appreciate the overview we got from Derek about the role of digital and young people. So as Girl Effect, we use the power of media and technology to unlock the power of girls. So we work with young people like edutainment, looking at the fields of SBCC, HCD, gender. And so we work from chatbots to chat shows to drama, to TV dramas, and then to tech. So it's a holistic integrated package. So we use these packages to support girls make better choices and changes in their lives so that they can choose better choices for their health, learning, and livelihood. And then also just to point out, we lead with the girls, but then we also believe that around her, she has her influencers. And so when we dwell in on her, then she has this effect around her, hence the word Girl Effect more broadly. We also work with digitally disconnected communities, and we take technology to them, hence also addressing the digital divide. So we're in Kenya, Tanzania, Ethiopia, South Africa, Nigeria, and India. So I'm happy to take you through the work that we are doing in Kenya that's on Wazi. So Wazi ni space yako. So Wazi, for the Swahili speakers in the room, means open or cool, and then space yako means your space. So what happened is that in partnership with MSD for Mothers, we worked on an MVP, a minimum viable product. So we wanted to work with the young people to come up with a product, a digital product that supports unmet need for family planning. And so there's a lot of co-creation with the young people. And then so what this platform is about an ecosystem, a product ecosystem, integrating SBC messaging, tools, and what we call concierge services. So beyond messaging, beyond talking to girls about SRH and their concerns in there, we link them up to services and other resources within the chat. So it's an end-to-end platform that supports girls and young people really with young boys. In fact, we actually saw boys also in the platform, a lot of them. I think they're curious and we are happy to have them in the chatbot. There's a next slide, please. We wanted to, so how did this come to life? So after the co-creation of the MVP or minimum viable product, we had a lot of awareness around it. So we had to create demand around the Wazi chatbot. So we had Facebook, we were on Facebook talking about Wazi, Instagram, TikTok, YouTube, Twitter, Google, we're everywhere around our young people, of course, highly segmented. We were working in 2 counties. It was a pilot in Migori County and Nairobi County. And then once we mobilize them, they get into the platform, we engage them. So these are menu-based chatbot with different modules. So depending on what a girl or a young person wants to engage on, we take them on that journey. And then finally, basically, if they are interested in taking up a service, we had partnerships with a couple of service providers. We had partnerships with Penda Health in Kenya, who is a private provider with many health facilities. We also had Kasha, who would sell to them product if you want to buy a product through our chatbot platform. We also worked with Tigres Current Tico in terms of just ensuring that we have options for girls for services. So that is how it came to life. And so our next slide also takes us through what that is. We have a small video and I hope it plays. I hope it plays. Technology sometimes can be interesting.
Do you hear it?
I know the audio is no, I can't hear the audio.
Okay, hold on 1 minute.
Okay,
let's see.
But yeah, as I was mentioning, hopefully the video gets to play. But the young people, we co-created that, and so we had people come to the chatbot. So we had a couple of good data in terms of what you were seeing. People were excited about it. We had a very high reach in terms of young people coming to the platform. We're looking at around 5 million reach. And then, oh,
it's
nice.
dry,
Okay.
clinical, and tough to talk about, especially for young Kenyans. Here, stigmas and cultural norms make it more than awkward. They make it dangerous. Young people need access to accurate information and support for their safety, their rights, and their futures. We need a space to talk about sex. Bila shame. So we created it. Working with young people like me in Nairobi and Migori, Girl Effect built a chatbot especially for us to answer our questions and direct us to health services. But Wazi is more than a bot. It's a catalyst for change, transforming the local approach to sexual health so we can talk about it openly. With the help of our cool co-creation team, we made a relatable brand that reflected our personality, culture, and lingo. We called it Wazi, an intentional misspelling of Swahili's love for cool or open. Through social media, radio campaigns, and community activations, we created a trusted space to connect, learn, and get support. And with all the knowledge of the health service, it with zero shame, Wazi is breaking down barriers. The pilot phase was huge. The impact? Now, Wazi users understand sexual health better, which means better healthcare, better outcomes, and a better space for young people.
Wazi, ni space yako.
Wazi.
Yeah, thank you for that. I'm grateful that it played. Thank you for that support. So beyond Wazi, we're also tracking some behavioral drivers, some social behavior change goals or communication objectives that we had. And so the next slide talks about the shifts that you are seeing. When it comes to knowledge, we had three. We had knowledge, we had outcome expectations, and perceived expectations. So we saw an increase in knowledge from 40% to 61%, and then more specifically around STIs from 38 to 46, and then the idea of where you can get where you can get contraception, you can access contraception also improved from 10 to 19%. And then on outcome expectation, that is the number of girls who believe discussing their needs can help answer their questions, increased from 65 to 73. And then also the whole idea around health services, provider services, and what expectation that would be increased from 48% to 61%. And then we saw confidence in health workers, maintaining the whole idea of confidentiality, which is a big issue for young people, increasing from 43% to 56%. And then, as Modoni had said, we recently won 3 awards that were held in Nigeria called the Future Awards, and we're very grateful for all the support across board. Next slide, we are looking at some of the dynamics beyond the pilot. We are looking at expansion in terms of learning better on our tech, building more on the media ecosystem. We want to ensure that we expand our program focus areas. So we're integrating other areas around mental health, around HIV testing. So our dream is for this chatbot to be a one-stop shop for young people and SRH and more. Yeah. And then we're also talking to more partners who have digital solutions so that we leverage on each other's strengths. So we are building a platform to accommodate more opportunities or more digital opportunities that are out there, while building our learnings with the national team and hopefully scale in 25 and beyond. So thank you for listening. Please put your questions on the chat bot. I'm happy to respond to them as we go. And I'm happy to pass this over to my colleague, Dr. Tariku. Please go ahead. Thank you.
Thank you, Nancy. A warm welcome to everyone joining us in this panel today. My name is Tariku Nugatu. I'm Deputy Chief of Party for USAID's digital health activity implemented by John Snow Incorporated. Today I will be speaking on behavior change interventions embedded in digital health interventions that improved the uptake of services and the desired providers' behavior. Next slide, please. So just to give you a little bit background about the digital health activity, it is a 6-year activity that is being implemented with technical and financial support from USAID. And the activity basically supports Ethiopia's information revolution agenda. And this information revolution agenda has 2 pillars. The first is digitization. The second pillar is data use. So my focus today is on the digitization aspect. So the digitization process basically embedded SBC interventions to ensure use of digital tools to bring about desired impacts within the health system. So basically the digitization process has a continuum, and it starts with designing. During the designing stage, we make sure that we use human-centered design, by which we make sure that end users are at the center of the digital tool development process. We carry out co-creation exercises so that end users of these digital products make inputs and participate actively in the development of the designing of the digital tools. During the development process, digital tools basically development is not a one-time process. It is an iterative process, and when the software engineers take inputs from the design and start developing the digital product, they conduct user acceptance testing, and based on the feedback from the user acceptance testing, they iteratively improve the digital tool. Once the digital tool is ready for deployment, our field staff continuously collect user feedback, and based on the user feedback we collect from the field, we make a corresponding optimization and enhancement to the digital tools. And during when it is being implemented, we make sure that we identify super users and champions, and we give them rewards to motivate early adopters to encourage others within the health system to start using digital tools. Next slide, please. So there are different digital tools that the digital health activity has developed over the past 6 years, over the past 5 years. We are left with 1 year to close. And there are point of care applications that we developed, which include the electronic community health information system that are used by Ethiopia's frontline health workers called health extension workers. And we also developed electronic medical record system. And these 2 point of care applications passed through these digital tool development processes. Basically, when these digital tools are deployed, the ministry has given a direction for dual use of systems. We were not immediately replacing the manual system with the electronic system. So health institutions were using the manual system at the beginning, and then they gradually switch to the electronic system until they go fully paperless. So accordingly, we have made 25 health posts paperless, 1 hospital paperless for community health, electronic community health information system, and we have made 1 hospital and 1 health center to fully go paperless by deploying AMR. The fact that these health institutions have gone paperless means they have entirely started using the digital tools during service provision. So it is very important that utilization of these digital tools is critical in terms of us harvesting the health outcomes that we expected at the start of the study. So we designed studies to assess the impact of these institutions that went paperless. Next slide, please. Yeah, so this is an impact assessment we conducted, and the design we used was a non-equivalent groups design to assess the impact of health posts, where the health extension workers use electronic community health information system. And there were significant, so it basically compared health posts that went entirely paperless against health posts that are using the manual system. So we compared conventional health RMNSH indicators that included ANC uptake, institutional delivery, postnatal care, and maternal continuum of care. And across these indicators, we were able to see a significant improvement in the uptake of these services among women. Next slide, please. We also tried to assess the behavior of health care providers, especially how they counsel mothers on maternal danger signs during antenatal care visits. And we're able to see changes in healthcare providers in counseling pregnant women during antenatal care visits. Specifically, they raised and discussed specific danger signs like, bleeding, the possibility of bleeding, severe headache, and abdominal pain, including convulsions that a pregnant woman might experience, which compared to health posts that did not implement, that did not go paperless and did not implement ECHIs, showed significant improvement. Next slide, please. And we also designed a pre-post study in one of the hospitals that went paperless after implementing AMR. And we tried to see the impact of AMR on mortality, and we were able to see an immediate and sustained change in mortality after the hospital went paperless. Next slide, please. Also developed a proposal and started piloting an artificial intelligence that is integrated into the electronic community health information system. Just to give you some background on this, the health extension workers in Ethiopia prescribe anti-malarial drugs for patients after conducting rapid diagnostic tests. However, there was issues with regard to the sensitivity and the specificity of their reading of the RDT. So we embedded an artificial intelligence within the ECHI system so that it will increase their ability to correctly diagnose patients presenting with fever. And there was also this widespread over prescription of anti-malarial drugs for patients, even though they are RDT negative. So this AI introduction is expected to improve the health extension workers' prescription behavior of anti-malarial drugs, because it gives them better sensitivity and specificity in terms of reading the rapid diagnostic tests. Next slide, please. Thank you very much. That is all my presentation. Thank you very much. Over to you, Mutoni.
Sorry, I'm encountering my own tech issues. That's a lot to unpack in under an hour. We have about 10 minutes, 10 to 15 minutes. We'll use 10 minutes to do a Q&A and then wrap up in 5. So I know that there's a lot of questions on the Q&A and also on the chat. So I'll start tackling a few. So the first one, there's a lot of interest around the WASI chatbot. So Nancy, the first one is, how have rural youth been involved in projects using different technologies such as chatbots? This is a question you can't really run away from. So.
Yeah, thank you, Mudhoni, and thank you for all the interest and the questions. And I'm happy to have follow-on discussions. So I'll send my email, or we can get it from Mudhoni. I'm happy to engage further. So the rural audience were part of our co-creation. I mentioned we're in 2 counties in Kenya. We're in Nairobi, which is very urban, and then we are also in Migori, which is very rural. We did have more uptake, to be honest, in terms of the rural audience, in terms of the chatbot. We have higher penetration in terms of digital growth within the more urban areas, but there was equally an interest in the rural areas. We had USSD format, equivalent USSD format, but the chatbot did do better in terms of uptake and interaction. So one of the things that we are thinking of doing is, how do we ensure those conversations are in a digital format and we engage the young people wherever they are. So we have something upcoming, we're calling it the Champions App. So it's a PM-led model, taking the digital efforts to the young people. So that's how we continue working on the young people and with the young people. But there was good interest and they were involved in the co-creation.
A big question for you, Nancy, before you go. And you know, we could still find a way around answering this question, which is, in the pilot and beyond that, what is the cost implication to create, launch, and maintain a platform like WASI, a beautiful presentation, etc. So basically, it's talking about cost, which is the $1 million question.
Yeah, so we had some funding. We had some initial seed money to support in the setup. I mean, it was, it was, can I say, the whole cost, I can come back to the team in terms of the actual cost of production, but there's a lot, like I can say, out of the entire funding we have, 50% went into production. So at Galifect, we have an entire department on Create that supports production, that supports our tech journeys, and so that might differ from organization to organization, but it's expensive, a bit expensive, to just ensure that you have a good platform out there. But then once that is done, and then we have, like where we are now in the current phase, we are seeing that it's easier to maintain. So there's a lot of production costs at the beginning of the process, but those ones tend to taper off as you stabilize the platform, as you know, you go through those teething problems. Those ones happen. And we took a bit of time in that because this project, we actually did the pilot in like 3 months. out of like a year. So we had most of the beginning of the year was about co-creation, insights, having test environments, test platforms, ensuring that we can talk to end users, that the menu-based platform is working for them and they're engaged. So I can say there's a lot of time and resources that is involved at the beginning of setting up, but then that one eases off as soon as it's a ready to engage platform. And you continue learning and you continue growing it because also one of the things that you come to appreciate is how technology evolves, the nature of how fast it evolves.
Right.
And keeping up with that, yeah.
And I know my M&E and my data people want to hear this, but Tariku, this is for you. Do you think the use of digital is the reason for the improvement of the indicators or because of better data collection?
I think it's both.
Thank you. Thank you very much. I've tried to provide answer in the chat box, but I can also say something here. Given the design of the study that we did, it's just a quasi-experimental study, and it does not lead us to entirely attribute the change to utilization of digital tools. However, the comparison we made was between facilities that went paperless and facility that is using the manual system. So the pathway, like data quality improvement can be in the pathway of change. And there can be many other factors, as long as what we are trying to do is to say that the fact that the health facilities went paperless has helped improve some of the indicators that I mentioned.
Thanks, Tariku. One last question before we go to our wrap-up. This one, I'm shooting it to Mokshada, and it's out of the reflection of our conversation today. I'd like to hear more about how the translation from insights to intervention design and how implementation happens. What were some of the best practices and learning?
Yeah, thank you. That's I think a really important question. And the way I like to think about is that, when we use technology, there is a lot of science involved, but when you need to translate that into an intervention, that's when, a lot of the art and the soul of the work comes into play. So as we've been hearing, co-creation, co-learning sessions, like that's been the heart of what we've done as well. I think one needs to keep in mind who your end user are, what is the context that they live in, what are their requirements, and therefore the intervention or any technology or any intervention that you're providing to them, like does it resonate with their needs? So for us, like that has been an extremely important learning. At the same time, the second learning has been, we want to take data-driven, like that's the core part of the work that we do at Sergo Health is you want to still take a very data-driven and evidence-based approach. So how do you ensure that in all of this, like the essence of what your analytics and your data showed you is also not getting lost? So I think there's a lot of balance to be played, keeping in mind the end user. So these have been in a nutshell, some learnings for us.
And finally, this has been a really interesting and informative session. There's a lot to look forward to in the future, with a promise of innovative ideas to revolutionize further the landscape of social behavior change. Some of the ideas that have been shared today and some of the key messages we've had in today's session include inclusion, the value of working with end users, amplifiers of change and champions, etc., and the need to move the needle further for SPC with technology. There's a lot that we need to unpack. Unfortunately, time is not on our side. But by harnessing these cutting-edge technologies, the future of social behavior change holds the potential for more targeted, efficient, and impactful interventions that will drive meaningful and lasting change. I would now like to invite the panelists to share in less than a minute, the change pathway they see in the future for SPC in the evolving technology landscape. I'll start with you, Mokshada.
Sure. Yeah, thank you so much. Again, this has been a great, discussion, also learning session for me to learn from everyone. I want to say, like something very similar to what we've been saying, that technology, is going to only advance. It's only going to get better, and therefore it's going to be quite impactful. It is going to help us be a lot more efficient by, being able to deliver with a lot of precision, with a lot of personalization. And as we've heard today, technology can, serve and enable several use cases, and it can be used in a lot of ways. But while all of the advancement happens on technology, I think again, like it's extremely important for all of us to keep in mind the end user and the use case in mind, really not to deviate and from what are the problems that we're really trying to solve. And I like the way I like to understand this, like this is really when the interplay between science and art happens. So it's very important, to understand and make both the worlds marry, and meet the objectives, right? Also, like we've discussed, that co-creation and designing with the user for the user is extremely important. And lastly, keeping in mind, how do we scale this up for long-term impact? How does technology reach to many, many more people? Also has to be, a core of what, this all of the work around technology is. Thank you.
Thanks, Mokshada. And you, Nancy, closing remarks?
Thanks. Yeah, thank you. Just to add on what Mokshada has mentioned, I think for me will be three things we need to think about. One, the change, the rapid technology change. All right, the rapid technology change. So how do we as an SPCC sector keep up with that? Because as soon as, like, for example, we are menu-based for the Wazi chatbot, but already thinking AI and how to integrate that. And as soon as I'm sure we are done with that, there'll be something new in the market. But we can't, because then, as Mokshada said, we are working for the young people in their platforms where they are. We must keep up with that rapid technology change. And then the last one I'd like to lay emphasis on is the evidence. How do we continuously build a robust evidence base to support our work, especially in digital? And that is so crucial to secure funding and ensure scaling up of successful initiatives. So let's keep talking about our work and making sure we are measuring to the extent possible the pathways and also the evidence that we are seeing, or the impact or the outputs that we are working towards. Thanks. Back to you, Muthoni.
Thank you so much. A lot of us want to hear how evidence can inform decision-making and program implementation. So thank you, Nancy. And finally, last but not least, Dr. Tariku, over to you.
Thank you, Muthoni. Can you please remind me the questions?
So the first one is just a wrap-up in under a minute. The change pathway you see in the future for SPC in the evolving technology landscape. What do you see in the future?
Yeah, I don't think I heard you clearly. Can you repeat? Sorry.
Yeah, so I'm saying, what do you see in the future of the work that you're doing in Ethiopia with technology?
Yeah. We are a technology platform, and we have been implementing digital technologies, various digital technologies across many areas of health, like supply chain. We have digital tools that directly providers use to interact with clients and patients. We have digital tools in the regulatory sector, in the health regulatory sector. One of the critical things that we have been grappling with so far has been the adoption of these digital technologies, and we have been trying to make sure that these digital tools are used by the intended users. But there were a lot of challenges on our way, and we have been trying to reinvent ourselves and adapt to changes. And we have a platform to regularly collect feedback from users and make corresponding enhancement and optimization to the tools that we are supporting. So the role of
Thank-
SCPC in this is very critical, and we have been trying to mainstream that across all the development stages of the different digital products that we have been supporting.
Thank you so much,
Thank
Dr. Kariku, Nancy, and Mokshada. That was amazing. A lot of conversations in the chat and in the Q&A. We'll continue to respond before the session ends. But I want to hand it over to say thank you to the panelists, to thank the organizers. You've done a wonderful job, and to pass it back to Farah.
Thank you very much, Mathoni, and thank you to all of our panelists for this insightful panel. Thank you for also being on time. For now, I would like to tell you all that I enjoyed facilitating the day with you, and it's been a day full of diverse and inspiring group of panelists and participants. I'm sure everyone shares the same thought with me, and looking forward to the coming days of the summit. Still encouraging everyone to participate in the chat and the Q&A. And last but not least, it's my pleasure to end the day with Cecilia from Nigeria, who will sum up the day for us.
We see your video on, but you still need to unmute, please. Thank you.
Hello, everyone. This is Cecilia from Nigeria. And I'm grateful for this opportunity to wrap up this session. From all of us at the Watch Party at UNICA, we are saying hi. Hi. Okay. So it has been quite an impactful session, an interesting one for all of us here, reiterating the fact that we are here to connect, learn, share experiences, and then learn to lead change in our different communities. Reminding young persons that they are the heartbeats of the nations, and they need to learn to take up health challenges and then change challenges. From all, we want to thank our panel sessionists, panelists, our speakers for sharing their experiences and then spurring us to take up change challenges. Because we had Ma Belinda talked on SBC being self-centered and that defend the diverse definitions of SBC. SBC is committed to promoting health, education, information, and creating awareness, reminding all that of the need to inculcate SBC in the public health space. Sir Emmanuel spoke on the need to use social media to create awareness, to cut down stigma surrounding HIV, gender-based violence, and then the need to personalize communication in this era, and left us with a powerful quote that we do not tell people to change, rather we let them lead the change, we inspire and support them to be the change themselves. Ma'am Jessica speak on the need not to modernize cultural traditions, but to learn to integrate them using the SBC way. And that the Gen Z era are very influential, using their social media platforms to influence people. And thus they need to include them in the SBC space. Sir Olushina shared his personal journey, an interesting journey with us. And also he shared with us the challenges faced by SBC practitioners and the numerous opportunities that the SBC space brings us. Ma'am Angela reminded everybody that we should not let our educational background deter us from diving into the SBC space, that the SBC is multidisciplinary. Sir Derek emphasized the need to integrate ICT use in SBC, the use of mobile penetration, the need to collaborate and co-create, and then the need to create ICT hubs, cyberspace, virtual hub, and support young-led digital initiative. From the panel sessions, we got value from the use of social media, the power of social media and technology to unlock the power of girls, digital health, the different digital health tools that have added impact to assessment and the various health services, reiterating the fact that We need to work together. No one person can complete the SBC intervention. And it has been quite interesting for all of us here at the Watch Party. Thank you for having me. And it is a bye from all of us here at the Calabar Watch Party.
Thanks, everybody. That's a wrap for today's pre-summit event. We look forward to seeing you tomorrow for day 1, and then again on Thursday for day 2. All materials and recordings will be available on the AS/SBC.org website, but just give us a little bit of time to get those things up and running. So thank you.